Ladies and gentlemen, first thanks to organizer. The motion is OA is an inflammatory disease, and I have been hearing Dr. Ghosh spinning a yarn, and I have been wondering what has he been talking. Jalebi ki tarah ghumaye ja raha hai, and it is going to be my duty in the next 10 to 12 minutes to unravel the mystery and tell you how exactly he has managed to confuse you. I have a very dear friend. She's interested in gardening. She one day got a thorn prick. And unfortunately, normally nothing much occurs, but it became infected. It actually landed up developing a systemic infection. She was admitted for almost a week, but luckily she came out of that trauma. So all of us know thorn prick causes local damage, but thorn prick can also, like in her case, it can cause SIRS, which is systemic inflammation, sepsis, and that it can also cause damage. Is thorn prick an inflammatory disease? Food for thought. So, I think it's always better to go to the very beginning, because that's a very good place to start, like Julie Andrews said. See, let us see the definition. It is inflammation is body's response to injury or infection. And if you realize in that ORC guideline, which my dear friend underlined, he made you focus on the third and the fourth line, whereas the first sentence said the macro/micro injury, which he totally forgot, and he kept underlining the lower part. I don't know who is mischievous, the organizers or my worthy opponent. There are many diseases which have got inflammation as a component. You have a thorn prick, you can have a rotor accident, you can have inflammation. You have a burns because of heat, you can have effect is inflammation. Gout, crystal formation, effect is inflammation. Cancer, ladies and gentlemen, is multifactorial, effect is inflammation. Aging, in fact, they have given, aging has been associated with inflammation. They give a name called inflammaging. Osteoarthritis is biomechanical state, effect is inflammation. Some of you may recognize Martin Luther King. He says, I have a dream, the famous speech. Last night, I had a dream. And what the dream was that Dr. Ghosh and I are both obstetricians, and he's doing an ultrasound on this 26-year-old girl who's come with pregnancy. Her husband is there, and there are a lot of PG students standing. He does an ultrasound and shows a gestational tract. So I look at the lady and say, congratulations. And Dr. Ghosh, with all his serious face, he looks at the husband and says, you have got STID. So all the PG residents nod their head, so does the husband. They all go away, and I'm the only one who's confused. I look at Dr. Ghosh and say, Dr. Ghosh, what is STID? He says, she has got sexually transmitted inflammatory disease. I said, aha. So I say, let me understand. I said, ST, now I've been married for 30 years and I have got 2 sons, so I understood the first 2 words. Okay. Then I said, Dr. Ghosh, she has got a disease? He said, DrShankar, the only disease with 100% mortality. All of us are destined to die. I said, oh, okay. But inflammatory, aren't you stretching it too much? He says, come on, you don't read journals? Don't you know that there is Th1 type inflammation in pregnancy? You have got inflammation, DrShankar. So this is every life. You know, inflammation is a new kid in block. Everybody wants a share. It's the latest Me Too in the field of osteoarthritis is one of them. And as per Dr. Ghosh, life is a sexually transmitted inflammatory disease with 100% mortality. So I said, you know, Mark Twain had remarked, to someone with a hammer, everything looks like a nail, and to Dr. Ghosh, everything looks like inflammation only. And he totally missed the point, both in my dream and in the last 12 minutes he kept talking about. When do we call a disease is inflammatory? I think there should be at least 4 major way of thinking. One, it should be the inflammation should be the primary driver. It should be easily detectable. Anti-inflammatory drugs should have some kind of effect, and it should land up leading to damage. Let us look at it one by one. Before that, we know all of us in this audience, intelligent people, know things like rheumatoid arthritis, ulcerative colitis, fulfill all the criteria. So, does OA fit the bill? Let's see. Now, is inflammation the primary driver? Age. With age, there's no reason to believe. I've compared it with RA. Clearly, it increases with age. Obvious trauma, meniscal injury increases the risk by 10 times. Asymmetry. Why should inflammation confine itself to medial compartment and not go to the lateral compartment? Obviously, it is this thing. Congenital malalignments, all of them, and all the so-called genetic things are associated with variation in the joint structure, which causes a increased amount of load. And all of us know excessive loading. The previous speaker, she even said semaglutide se tumhara osteoarthritis kam ho raha because weight is decreasing. Now, clearly, this all suggests that inflammation is not the secondary effect. Even animals don't believe with him. I looked at a meta-analysis and found that, there are hundreds of models and hundreds of meta-analysis of rheumatoid arthritis, so I won't bother about it. But I looked at the latest meta-analysis 2023 on animal models. 36 studies, they were able to induce osteoarthritis, nothing with inflammation. They had to actually break the joint, either mechanically or by injecting some iodide or something like that and all. They had to take the mechanical pathway, whether they could not get the inflammation at all. Dr. Ghosh is confusing cause and effect. All crows are black. All black things are not crows. Dr. Ghosh, that is a hat. Cancer has inflammation as its component. Cancer is not an inflammatory disease. Pregnancy has inflammation as its component. Pregnancy is not an inflammatory disease. Osteoarthritis has inflammation as its component. Osteoarthritis is not an inflammatory disease. Second point, is it easily detectable? In rheumatoid, it is clinically visible. ESR, ECRP is visible. You have got so many extra-articular manifestations. You get vasculitis, all complication. In osteoarthritis, you have to search it like the lens, like a mother-in-law. A mother-in-law can look at a sorry to all the mother-in-laws here, but you will understand, the daughter-in-laws will understand. Mother-in-law can look at last 25 years of marriage and say, I can remember 6 instances when she insulted me, and she will forget the 100 times she was good. Dr. Ghosh is doing exactly thing, is selective cherry picking, So it is something like, how many push-ups can Superman do? Let us say he can do 10,000. I can say, look at me. I also have got Subramanian, Superman, little bit, this thing is there. He's wearing blue and red. I'm also having little blue and red. I'm also Superman. I can do 10 push-ups. No, it doesn't work that way, Dr. Ghosh. These are two different things. You have to, land a preaching. So this is not called inflammation. It's called delusions of grandeur. The third thing is, do anti-inflammatory agents retard progress? For rheumatoid arthritis, you have got conventional DMRs, biologics, small molecules, systemic steroids, all of them fail. And I didn't know so many other things have failed, which Dr. Vincent just now told all of us. Intra-articular injections, at least in rheumatoid, it reduces the thing. There, it is not only ineffective over a short 6 weeks, 8 weeks, every time steroid will work, then it also causes lot of damage. This is called action bias. When you look at football, I think people will understand. They did analysis, found 1/3 goals go to left, 1/3 goes to right, and 1/3 goes to center. So technically, the goalkeeper can always keep standing in center and he'll be right. But they check 90% of the time he will dive, because it looks stupid if you don't do something. If you don't dive, right? So the osteoarthritis people keep playing around with kabhi canakunimab, wo mab, ye mab, adalimumab, one steroid, one this thing. Everything is failing, but they have to be seen to be doing something against the inflammation. Okay, lastly, does inflammation lead to damage? I will give you, it's both mechanical thing and the inflammation leads to damage. So I'll give you a little bit of marks here. So if I was your examiner, you get 0 out of 10 in inflammation primary driver, 0 for easily detectable, 0 for anti-inflammatory, but I'll give you 5 out of 10 for this. So you are 13% marks, I've increased it by 0.5%. So how do you even dream that you are an inflammatory this thing? I had a grace mark. I had a PG resident, he was always, for every diagnosis, his thing was cardiopulmonary arrest. Person will die of pneumonia, diagnosis. I said, yeah, you're such an intelligent man. Why is everything cardiopulmonary? Sir, until the heart stops, only then your person dies, no? So I said, no, son, you are falling for what is called as a funnel effect. Every disease will have, the definition of death is heart stopping. So he says, it took a long time for that poor child to understand. Same mistake Dr. Ghosh is doing. Every illness has to go to inflammation. So cause and effect is totally confusing. And he's going there and saying this is the stuff. I had bet with myself before the start that Dr. Ghosh will speak for at least 6 minutes, confusing you on inflammation. I lost my bet to myself. He spoke for 9 minutes. And he kept talking about cytokines and inflammation. And half the time he was speaking in my favor also at some levels. So, in Hindi movies, sometimes when you're angry, you throw a glass. And you throw a glass again and again to prove a truth. So Dr. Ghosh kept doing the same thing again and again. But two wrongs don't make a right. They just make a good excuse and manage to confuse the audience. He did so many wrongs, there is no way it's inflammation. Is it mechanical? Of course, I have already given the points, I'll just put it all together. It is an asymmetrical disease by and large. So the point is, and all of us know whether trauma or whether it is a congenital malalignment, meniscal injury, all of it increases risk. This is a well-known thing. I've been a doctor from 1988, 36 years during, it's you. I thought it is Dr. Ghosh saying, thank God. Okay, yeah. So, yeah, so all of us know localized trauma increases it. Obesity decreases, even semaglutide lands up improving your osteoarthritis. Age causes micro trauma, sometimes macro trauma, hidden trauma, whatever, and it is directly associated. Of course, one can land up going into technical details about collagen, cross linkages and all, but comes to the same. It's just a sophisticated way of saying it's trauma. All animal models, you have to generate inflammation through a mechanical process. Genetic influence is not for generalized OA. It is because of the specialized types of variations OA where the joint structure gets changed. Osteotomy benefits OA. All the mechanical things like your distraction benefits OA. All these things suggest it's mechanical. Weight loss reduces OA. And clearly there is no evidence of inflammation which you can pick up. Cytokines and enzymes and all the things, high-tech stuff which has been mentioned by Dr. Ghosh are actually effects of, and the word itself is mechano-inflammation. But the pehle mechanical panga hota hai, uske liye inflammation is a body response. Ladies and gentlemen, this is my simple model of osteoarthritis. There is nothing has changed in the last 50, 60 years or ever since. It has always been mechanical stresses. Even today it will remain mechanical stresses. It causes damage directly, but now we have become smarter and we have been able to give some names to all this inflammation, and we talk about cytokines, epigenetics, genetics, blah, 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 blah. But it is still the same thing, but it is just like pregnancy. It doesn't become an inflammatory disease. So, Dr. Sir Robert Hutchison had shown, for a zeal for the new and contempt for the old, good Lord deliver us. Good Lord deliver us from Dr. Ghosh and his machinations. Thank you.